Dermoepidermal junction. In case of we're seeing the part 2, so here we are going to discuss in detail the hemidesmosome. In case of the hemidesmosome, they are the multi-protein complexes, and they facilitate the stable adhesion of the basal epithelial cells to the underlying basement membrane. Next, there is also presence of the intermediate keratin filament. Here the intermediate keratin filament, and this includes the K5 as well as the K14. They are present within the basal keratinocytes. Basal keratinocyte, and it attaches to the hemidesmosomes. Attaches to the hemidesmosome and at the base of the cell. Next, there is a major hemidesmosomal protein. It is the BPA. BPA stands for the bullous pemphigoid antigen, and it is nothing but bullous pemphigoid antigen 1. So it is also known as the BPAG1 or the BP230. And what this does is it attaches to the transmembrane protein, that is BPAG2 or the BP180 below. Next, the other hemidesmosomal protein is plectin. The plectin is attached to the transmembrane component of the protein. It is known as the A6B4 integrin, alpha 6 beta 4 integrin below. Next, we are looking at the anchoring filaments. In case of anchoring filaments, it is the lamina lucida and the lamina densa which are involved. Next, the anchoring filament from the lamina lucida layer. The anchoring filament, it consists of the laminin 5 as well as the 332 proteins, and what this does, it connects the BPAG2 and it connects the alpha 6 beta 4 integrin, and this is above to the lamina densa below. Next, what we have is the lamina densa. This lamina densa, it consists mainly of type 4 collagen and the other proteins such as the nidogen. Next, we are looking at the anchoring fibrils. In case of anchoring fibrils, they are the ultra structurally U-shaped structures. They attach the lamina densa above to the underlying connective tissue below dermis. Next, we have the type 7 collagen. It is a major protein in the anchoring fibrils. In the anchoring fibrils, there is blistering disorders in the. There can be the blistering disorders. It occurs in the DEJ, that is nothing but the dermoepidermal junction, and it arises due to defects in the antibodies against any of the above mentioned proteins due to the proteins.